Welcome to Growth TV. I'm Carolyn Vallejo. Healthcare costs are on the rise, with Fortune 1000 companies expected to shell out up to 11% of their overall earnings to healthcare expenses by 2025. Companies in labor-intensive industries could be hit even harder. Here to talk about how employers can cope is Tara Krauss, Head of Accident and Health at QBE North America. Tara, welcome back to Growth TV.
Thanks for having me again. Pleasure to be here.
QBE recently released its 2023 Accident and Health Market Report. Could you tell me about some of the biggest trends that appeared from the data?
Sure. First and foremost, I'd say the alarming upward trend in the percentage of employers with at least one member that had in excess of $1 million in claims. We looked at a 5-year period, as you could look at the graphic we're showing here on the screen. From the period between 2018 and 2022, we've had a dramatic climb in that percentage. 3.5% of employer groups experienced at least one member with over $1 million in 2018, and that number more than tripled to 12.4% in 2022. Another trend that we looked at several trends. We study respiratory disease, circulatory disease, mental health, and neoplasms. And the frequency in mental health and respiratory certainly climbed from last year, but pre-pandemic levels, they're much, much higher. So while those took a dip during the pandemic, we can see that now that we're moving past the pandemic, the trend in those type of claims is significantly higher than prior to the pandemic hitting. But the most alarming concern really is with the neoplasm claims, which encompasses many cancers. Those increased in 2021 and 2022 after a decrease as a result of the pandemic in 2020. For those that did not see our 2022 report, we did make a prediction at that time that due to the deferral of care, the closing of facilities for the non-critical or for critical conditions, so for the non-essential care, we saw people staying home and not getting the care they needed, and certainly not getting the preventative services and the screenings. So we had predicted that there might be an uptick in neoplasm claims and in cancer claims once the pandemic settled and facilities opened and people got back out to see their doctors for the regular screenings. Neoplasms have typically been and historically been the largest percentage of stop-loss claims for us. And this is true again in 2022. I think what's most concerning is the percentage of stop-loss claims from neoplasms that dipped in 2020 and 2021 have really rebounded, and they make up 45% of the excess loss claims that we see studying deductibles of $200,000 or higher. This is really an alarming trend for us. It's almost a 20% increase year over year. So while it's always been the highest contributor to our top claimants, certainly this uptick year over year is something that we're paying close attention to. And there's a number of factors, certainly that deferral of care, but also just kind of looking at case intensity. We studied that. There's about a 14% increase in case intensity. And that's just by studying the average length of service. So some things that we look at with that would be, just some of the things it points to, I should say, that patients are sicker when they're seeking care. We all know that there's a healthcare worker shortage as a result of the pandemic. You had seasoned staff that retired, and now you have less experienced staff doing the work of the hospitals at this point. There's also a factor of being unable to discharge to post-acute secondary care, purely for the fact that those facilities are also having staffing issues. And hospitals aren't making profit based on how many days an individual is in the hospital. They're really reimbursing on what we call diagnostic-related groups. So this means that their profit doesn't really increase if the length of stay increases.
A lot of these trends that you just mentioned, as you say, are quite alarming. These are high dollar amounts that we're talking about here. What can employers do to manage some of these rising costs?
I know it can feel really helpless for an employer. It's true. It's their number one expenditure outside of salaries. And And it's a personal thing, right? They want to make sure that they're keeping the distance between their employer's health and them being an employer. But if they're a self-funded employer group, they really want to pay attention to the trends they're seeing in their claims. Providing affordable healthcare coverage is certainly something that helps attract talent, and not only affordable healthcare coverage, but a good benefit package that helps most employees manage their financial burden should they find themselves in a situation where they need to seek care. The healthcare market's a $4.3 trillion market, which is, I believe, nearly tripled since early 2000. So you can't bury your head in the sand if you're an employer group. You really need to get to know what's driving the cost on your health plan.
Mm-hmm. Are there any specific plan designs that can help employers, control some of these insurance costs?
There's many things employers can do. First and foremost, they got to make sure that they're in touch and hiring a really thorough, what I'd like to say, a healthcare consultant, right? Someone who knows what's out there. Some of the things that employers, certainly as we move forward from 2023 and on, is looking at medical networks. What kind of medical network are they accessing? Are they focusing on high performance networks? Managing specialty pharma is a big one. 50% of the drug spend for an employer group it comes from 2% of the population. And those are usually the people that have rare or serious conditions, are getting costly drugs, whether it be infusion or not. So just managing that piece, you can imagine the impact it has. Things like using formularies, utilization management controls, or even partnering with manufacturers for some of the really costly pharmaceuticals that are out there could really help an employer group control costs. Value-based care, looking at the quality of care and the outcomes, and tying provider reimbursement to outcomes are going to be critically important as we move forward. And there's a lot of evolution in the space around this, as well as just making sure that the financial incentives of the providers you're trying to align them the best you can to the patient. So the patient and the payer, making sure those financial alignments are connected in some way.
Are there any other strategies that employers can consider, outside of everyday management of their health plan?
Sure, there's several. We didn't touch on this, but reference-based pricing is a network solution they could use. Organ transplant, fully insured organ transplant carve-out, something QBE offers, helps to stabilize the self-insured renewal for self-funded health plans. Captive insurance is another big one, and it's making a lot of waves in the market right now. It's been around for a long time. 90% of Fortune 500 companies have their own captive. They're single parent captives, group captives. But for smaller employers who don't have their own captive, we have a product called QBE Captive Curve. That's our service model. That allows employer groups to access a ready-made, we call it a segregated cell, but it's basically a ready-made captive that they don't have to put the upfront expenditures on, and they can join a group model, and that allows them to kind of leverage, buying power with other employer groups to further help control their costs and provide plan flexibility and transparency, and leverage a great service model with a business such as QBE that offers services from underwriting to bordereau and risk management and claims advice. So those are some of the things. There are many that employers can choose from when really taking a hard look at how they control their healthcare spend.
Mm-hmm. A lot of really useful guidance there, Tara. Thank you so much for joining us once again. It is always a pleasure.
Pleasure to be here. Thanks again for having us.